And some people you can't get under their scapular border. They're just so tight. Sometimes we will see that with, I'm trying to think of who we might see that with. Somebody who's really tight through their levator and their rhomboids, you're going to have trouble getting under there if they've got a lot. But for him, look at that. I can get underneath his inferior border. And so then I can just get under there and I can just kind of mobilize him. For a lot of people, they love this. Sorry if my fingernails are poking you. Okay, so you can get under there. So you can just do some general distraction, which is going to increase motion in all directions. For facilitating, this is probably my favorite one and my patient's favorite one, for facilitating kind of that scapular depression, what we're trying to do with our scapular tilts. So first of all, I'm going to get on his inferior angle right here, and then his superior border of his scapula, and that's going to be kind of my driving force there. And all I'm going to do is I'm going to facilitate that motion.
And this is inferior glide.
Right. It's like an inferior glide, and you're getting just a little bit of rotation with that too. So I'm not doing a lot with this hand. I'm just kind of facilitating a little bit with that hand as I'm taking him into an inferior glide. And I think because a lot of our patients are just tight through their scalenes, this kind of gives them a sense of a different position for their scapula. So again, good body mechanics. So as I'm doing this, I'm swiveling through my hips. Okay, so that would be the depression, scapular depression and that's a really nice one then to follow up with then the scapular tilts and then have them actively work on that. For upward, well, what's next on your list? I'll go in line of, I'm sorry?
Medial glide?
Medial glide. So medial glide is for those patients that are really abducted. Ideally, and Ryan's fine, you should be able to get the medial border to the spine. Okay, if they've got enough medial glide through their scapula, otherwise this might be a good mobilization for them. So here, I feel more comfortable getting my whole thenar eminence on here as I'm doing that. And then this hand is going to go just on the lateral arm, okay, so right up near the deltoid. And all I'm doing here is I'm gliding medially. For those patients that are really tight through the posterior glenohumeral muscles, this is a nice one too. You feeling okay there? So again, I'm getting my whole body weight into this. Okay. Then for upward rotation, or is it downward rotation first?
Downward.
Okay, so for downward rotation, I'm going to bring his arm into a little bit of extension. I'm still going to be up at the superior border. So superior border for all of these, except for that medial glide. We're going to be more on the humerus, okay? Otherwise, it's superior border, and then his inferior angle here, the lateral border of that, and then I'm just going to basically rotate him. And this may help to facilitate a little bit of that adduction, extension, internal rotation. You feeling okay there? Good. Okay, and then the last one is upward rotation. So we're going to use this with a lot of our patients too. So we're going to support his arm. Okay. Once I have his arm supported, I basically put my what do you call this thing?
Thenar eminence, web space.
The web space. Thank you. I'm going to take my web space and I'm basically going to kind of hook that on his inferior
Does your phone kill
border.
you at the end of the day?
From this position? Like that?
Oh, you just got into a much better position than you were.
Yeah, this comes from old school bad stuff. Yeah. Here's a much better position.
New school.
So then I can just facilitate that upward rotation. Again, I'm swiveling or pivoting through my hips as I do this. And then I can take him into a little more flexion, and I can continue to kind of facilitate that. Take him into a little more flexion. And I've got his arm on my belly, so you better hope you have a little bit of a belly to be able to support him. And that feels pretty comfortable, right? So those are those.